So, how does it work for trauma? We're going to go over different specialists and why they believe that EMDR is effective. Greenwald believes that the main reason for EMDR, that it's so effective, is because it happens inside the client's mind. People think, on average, 7 times faster than they talk, he points out. Since EMDR doesn't require the client to talk through everything he or she is mentally experiencing, it enables individuals to talk with traumatic memories more quickly. Greenwald says since the trauma survivor is concentrating on the memory along with something external, it creates a dual force that allows the individual to be both in the memory and an observer at it at the same time. Goes on to say it combines psychoanalysis, body sensations, and psychotherapy all at once. Robinson adds, it's a bit of hypnotherapy too, so it really offers the best from many worlds of therapy. Robinson says talking alone reaches only the left side of the victim's brain, while EMDR stimulates both hemispheres. EMDR allows us to build synapses in the brain around traumatic experiences, she explains. It allows the victim to combine his or her experience with wisdom. Robinson says one way of understanding EMDR is to think of it like REM sleep. It helps people process their memories and put them in the past instead of the present. Joanne Twombly, who works in the private practice at Waltham, Massachusetts, has been using EMDR for treating severe dissociative disorders for 10 years. She works with patients and she calls what she calls huge child abuse issues and complex PTSD. What I will find is that bilateral stimulation, mostly bilateral tapping, helps to install coping skills. Twombly points out that the brain scans show the frontal lobes of the brain in trauma victims are often impaired. She says EMDR activates those frontal lobes in a way that talk therapy simply cannot. Trauma gets stuck in the primitive part of the brain. Twombly adds EMDR gets into the part of the brain for where those things are stuck, where they reside at. Sarah Beale doesn't necessarily use bilateral eye movements in EMDR and says that tapping on the hands or knee will work just as well. It's about stimulating both sides of the brain. It's similar to the eye movement we have during sleep. Like REM, EMDR again helps us process memories. Greenwald does not agree and says that EMDR calls on both the right and left sides to work, pointing out that the client can participate in the EMDR by moving their eyes up and down, as opposed to right and left, and thus cancel out the supposed connection between the two hemispheres of the brain. Regardless of the physical reasons that EMDR works, one thing is clear. It helps clients to differentiate between what's important in the past and what's important now. While CBT encompasses many different therapeutic techniques, Greenwald says it is focused mainly on management skills. On the flip side, EMDR transforms how people experience and react to their own memories. I prefer EMDR because it's well tolerated and it's faster, Greenwald explains. He says once a client has completed EMDR therapy, he or she will find an ability to revisit a traumatic memory and not be bothered by it any longer. Robinson says in her practice she has experienced an 80 to 90% success rate with EMDR, though she adds that because she is known for offering the treatment, many of her clients are highly motivated whenever they come in for treatment. That concludes this lecture, and I will see you in the next one.